Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I'm sorry I'm running a few minutes late. It's been a long clinical day here at Marty Ross MD Healing Arts, but I'm glad to be with you tonight and to see what you have in store for me. So as you all know, especially those of you who have been here before, you create the webinar with your questions. I don't have any defined thing I'm going to talk about tonight. Although it is interesting, sometimes we do get into a theme of the night, and I suspect tonight there'll probably be the theme of questions about the COVID-19 vaccine. So I am ready to talk about that, and if those questions should arise. So for those of you that are new here, the way you participate is two ways. Number one, you can listen in to the questions and the responses that I give. There's always a lot of education that I try to give out in these webinars. The other thing you can do is write a question to me. And the way you do that is over on the right-hand side of your screen down at the bottom is a chat box. The only thing I ask is that long questions get really hard for me to do here because it's hard for people listening in to follow. And sometimes long questions literally freeze up my computer using this webinar platform that I use. So if it's too long, I'm not going to answer it. So just keep that in mind. All right. And the other thing is I am creating a recording of the webinar tonight. And I will get that recording out to you probably by 9:30 in the morning, Seattle time, tomorrow, Pacific Standard Time. Usually that's what I try to do. Sometimes I get a little delayed doing that, but that's what my intention is. I'll have to do a quick edit on it tonight, and then I try to do a quick summary that goes out with it as well, too. Okay, so just look for that in your email tomorrow. And in that, there'll also be a link that you can use to sign up for next week's webinar. So we've got a webinar tonight and one the week after that. And then I'm going to not be here doing a webinar during Christmas, or I guess Christmas Eve, I guess is what that day would be. But I'm not doing a webinar on Christmas Eve. All right. So anyhow, yeah, I think, oh, one last thing. So during the live version of the webinar tonight, you all that are participating in the live version will be able to see the questions. I do post them in a way that you can read them on your screen. However, in the recorded version, which many people listen in on that don't participate in the live version, they're not going to be able to see that. So I will read each of the questions as well, in addition to posting them here. Okay. All right. So let's go ahead and get started. We'll take our first question here. All right. Hello, Crystal. All right. Let's see here. So hello, Dr. Ross. How was your day? Pretty good. Ran a little bit late, but pretty good. Let's see. I will need thyroid surgery at some point to remove half or all of my thyroid because of several nodules. My thyroid SEC molecular test results reported the biopsied nodules have a 70% chance of becoming cancerous. The surgeon mentioned they would check the surrounding lymph nodes in the neck to see if any need to be removed. Unfortunately, the surgeon does not believe in Lyme and co-infections and would not entertain any questions about Bartonella's impact on the lymph nodes, etc. I have chronically inflamed lymph nodes under my jaw, on my neck, and into my chest on the right side from Bartonella, and wonder what their impact would be on my surgery process. Have any of your patients had lymph nodes removed? What happens when you remove the lymph nodes in a person with Lyme and co-infections? Does a person become sicker because the immune system is taxed more? As always, I appreciate your help. So the truth, I have not had somebody in this situation where they've had lymph nodes removed either as part of cancer treatment or for other reasons in this. So I can't respond to you from a standpoint of experience. I haven't seen this happen before. It is true that Bartonella can lead to swollen lymph nodes. That's a common finding that we see with Bartonella, and sometimes it can be a sign that people have Bartonella if you see that. Keep in mind that your immune system has many parts to it. Lymph nodes are just one part, but your immune cell, we have the lymph nodes contain immune cells, but we also have immune cells that are in the blood, are in the lymph fluid that connects lymph nodes. You've got a lot of ways that the immune system functions beyond the lymph nodes, okay? And in my experience, in other conditions that I guess not in my experience, but what I know from treating non-Lyme conditions previously and having had people get lymph nodes removed as part of that, I've never seen chronic health problems get worse, and including people that had infectious chronic health problems, say like HIV, for instance, okay? So removing lymph nodes does not necessarily mean you're going to get a health decline, because you have lots of facets of the immune system that can still keep working, okay? Now, you did ask, might you get worse after this? And the only thing I would say is with general surgery, when people are given anesthesia gas, that means you're given a tube that's put down in your lung and they blow gas in you through a breathing machine. That's called general anesthesia. And I'm making a distinction between that kind of anesthesia and now something, a type of anesthesia where you're just put to sleep by giving you medicines in your veins. Okay, that's sometimes it's called conscious sedation. It's a weird term, but conscious sedation is where they give you chemicals to put you to sleep, versus general anesthesia is when they actually put a tube down your air pipe. Okay, with general anesthesia, in my experience and the experience of many patients or many of my colleagues that treat patients with Lyme, we tend to see that there can be some declines in a person with Lyme health after general anesthesia. We are not sure why. It's not clear to me what the mechanism is behind that, but the act of getting general anesthesia seems to lead to some decline in how people with Lyme are doing. It's short-lived. It's maybe a month or so, but it is something that can happen. So I just want to make you aware of that as well. There's really nothing you can do to prevent it from happening. It is something that can sometimes happen, not in everyone, but in a significant number of people. Okay? All right. Good luck to you with your surgery coming up, Crystal. Hello, Brandy. Let's see. Are there any other liver functions? And they increase when the liver is inflamed, or when a person is taking medicines that turn them on as well too. I generally like to keep those normal. I might be okay with somebody having one that is at 80 or lower. Okay. All right. So just to make you aware of that. In terms of those two, those tend to be the best indicators of liver function. You can also, other chemicals that we use in a liver panel, one of those is something called an alkaline phosphatase. That gives us a better idea of what might be happening with the gallbladder function. And there is another test called a GGT, and that kind of gives us a better feel of what's happening with the biliary system, the tubes that connect the gallbladder to the liver. But probably your AST and ALT are best ways of looking at liver function. All right. For somebody that has chronic liver disease, sometimes when the liver gets so scarred, when people get cirrhosis, which is scarring of the liver, the ALT and AST, there may not become elevated even if the liver is inflamed, because in cirrhosis, there's so much scar tissue that there's not a lot of tissue left to make ALT and AST. And those kind of situations, the way that we look at liver function is to measure some blood clotting test, actually, something called a protime and something called an activated partial or an activated protime. Those two tests can sometimes become elevated if the liver is so injured that it cannot manufacture enough blood clotting proteins, okay? So in somebody who's got cirrhosis of the liver or scarring of the liver as a result of having chronic ongoing years of inflammation, then we have to turn to looking at these measurements of blood clotting protein, okay? All right, so that's what I got for you, Randy. Good luck to you. Hello, Sarita. Let's see. In your practice, do you see air hunger sometimes as a symptoms of Bartonella, or is it pretty much just with Babesia? I tested positive for Bartonella and are leaky with Galaxin urine test, but negative for Babesia, and air hunger is one of my main symptoms, along with anxiety, and my legs burn when I walk up the stairs. I'm wondering if I should be retested or possibly treat for Babesia based on symptoms. How accurate are the Babesia tests? All right. It's a good question. So there's parts to your question. I'll try to break them down one by one here. So in terms of what causes air hunger, all right, so what is air hunger to begin with? So air hunger is a feeling like you can't get enough air in. It usually will happen while you're at rest. It can sometimes happen while you're active, but true air hunger, when I figure out somebody's got air hunger, it's usually an activity that happens at rest. And they don't have asthma, okay? So if you're developing air hunger, you got to make sure your doctors at some point have done a test to make sure you don't have asthma, okay? And often also with air hunger, people have normal oxygen levels in their blood, okay? If you do like one of those little clips that you put on your finger to measure your oxygen concentrations, they'll be normal, all right? So it's a sensation, okay? All right, now, we know it can happen in Babesia. It's not clear to me the mechanism of why it always happens in Babesia. And some people with extreme Babesia, where you might even get breakdown or hemolysis of your red blood cells that carry oxygen from Babesia, it makes sense. You would have less blood to carry oxygen, and therefore you'd have air hunger. But most people that have Babesia and air hunger actually have normal blood counts. They're not anemic. And so it's not coming from that, but it's not clear to me why people with Babesia get air hunger, but they do, okay? Also, Bartonella can give air hunger. And the mechanism probably by which Bartonella gives air hunger is that Bartonella, this other tick-borne co-infection, one of the things it can do is it can infect the cells that line your blood vessels, okay? So your blood vessel, is a big tube. It's got an opening, all right? And sometimes what happens is these cells that line the opening get infected. And when they get infected, they swell. And when they swell into the opening of the blood vessel, making it narrower, so not as much blood can flow through it, okay? And because of that, your tissues and your lungs can start getting starved of oxygen that's supposed to be carried by the blood, and you have a feeling of air hunger, okay? So even though I think the predominant views when you have air hunger, think of Babesia, I usually am looking to see if a person has one or both, okay? And in terms of how do you diagnose Bartonella, well, Bartonella, you can diagnose based on symptoms or testing. You tested positive, so you have Bartonella, okay? I also look at symptoms, all right? And the key symptoms that suggest Bartonella can be pain on the bottom of the feet, air hunger, a rash that looks like stretch marks or scratch marks. Sometimes people have a lot of neuropsych issues with severe thinking or bad psychiatric issues like bad depression or anxiety. And so you just kind of collectively look at a person. You think, are there enough symptoms to say Bartonella? Could it be? In addition, we can do testing, but the testing's not perfect. So sometimes you can still have Bartonella even having a negative test, okay? Regarding Babesia, same issue. Our testing is not perfect. With Babesia in particular, we think that there may be multiple strains, but we can only test well for about 2 or 3. Okay, so you could have Babesia and not have a strain that can be detected with testing. So symptoms that make one think of Babesia are drenching night sweats, air hunger, having some racing or skipping of the heart, having a lot of migraine headaches, or having headaches in the front of the head. And in addition, Babesia can sometimes give people a bunch of little red blood spots. It almost looks like these little marks that become elevated on your skin. They're very small, though. They're little hemangiomas or blood areas where you get a little bit of blood that has bled under the skin. Babesia can give you flushes of that, where you get a lot of that at a time. That makes you think of Babesia as well, too. Okay? All right. And so the Babesia test, even by IGenex, can miss Babesia often if you have it. All right? Yeah. So what I would do, if your Babesia testing has been negative, but you still have a lot of symptoms of Babesia that I just indicated, you might want to treat for Babesia as well, too. All right. So I'm going to do a quick screen share here. Oops, I can't do a screen share yet. Hold on a minute. I forgot to set up my computer so that I would be able to show you guys where you can find some of this information. So bear with me here. I'm just trying to get it set up. All right, so let me try to do a screen share here again. All right, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD. If you're looking for, if you want to see again the symptoms that suggest Bartonella or the symptoms that suggest Babesia, take a look at my online Lyme guide here. Take a look at the section, there should be a section here called How to Diagnose. And within this article called How to Diagnose Bartonella and Chronic Lyme Disease, I talk about the symptoms. And within this article about how to diagnose Babesia, I also talk about the symptoms, okay? All right. Sarita, good luck to you. And thank you for that question. Hello, Joe. Let's see. Hello, Dr. Ross. Do you find that Lyme and co-infections increase glucose? What can one do to reduce it? So in my experience, I have not found that Lyme and co-infections lead to increased glucose, okay? So that has not been a situation that I have seen. And, you know, I am a family physician by training, and so I used to manage diabetes as part of what I did until I moved into this crazy world of managing people with Lyme disease and fibromyalgia and chronic fatigue and mold toxicity back in 2000. But until then, it's family doc, okay? So when you get somebody with increased blood sugar, you would do the same thing for somebody with Lyme with increased blood sugar that I would do with anyone that has increased blood sugar. First place I would look is at the diet and trying to work with a diet that is oriented at lowering sugar, okay? Second thing I would do is try to get people to be more active. Now, I realize in Lyme that sometimes it's hard to do given that you're restricted in what you can do because you just can't handle doing activities. But that's where I would start. And the third thing I would try to do with somebody with elevated sugar is drop weight. If they're overweight, I would work on getting weight down. So the same approaches that I would do for anyone with elevated sugar that doesn't have Lyme are the same things I would do for somebody that does have Lyme. Okay? All right. Good luck to you, Joe. Hello, Brandy again. Let's see. Anxiety and carrying tension in the stomach to the point of forgetting to breathe, almost like the diaphragm dysfunction. Not sure how that fits with your other question, but I think I may have answered that before. All right. I think you were trying to let me know a few more things, but I'm trying to remember what your question was. I know I answered your question initially, but I can't remember exactly which one it was because I've already answered a few other ones too. All right. Tomorrow or later when I relook at the webinar tonight, I'll get to see that again. All right, let's see here. Hi, Debbie. Let's see. Can people with Lyme get scleroderma or scleroderma symptoms because of Lyme? If so, are there any treatments available to reduce the symptoms of scleroderma? Thanks for all you do. I've been a consult patient and have followed your webinars for years. Debbie Morgan. Hi, Debbie. Nice to know you're here. So, you know, Lyme disease in a small percentage of people, not everyone with Lyme, but a small percentage of people, Lyme can trigger autoimmune illness. And by autoimmune illness, I mean that your immune system starts attacking you, okay? All right. And which is different than having inflammatory reactions from the immune system attacking the germ. Rather, this is the immune system starts attacking your tissues and your cells, okay? And that's what we mean by autoimmune illness, is that your immune system starts seeing you as a foreign object that it needs to get rid of, or parts of you, okay? In this case, scleroderma means you have an autoimmune reaction against your skin and the connective tissues under the skin. Could Lyme trigger that? Possibly. It's also very possible you can get it as a separate problem, separate from having Lyme as well, too. Okay. And so I want to make sure that I'm clear what I said earlier. Not everyone with Lyme has an autoimmune illness. There are some people that Lyme can trigger autoimmune illness in, though. And we actually don't know. No one's done the studies to say when you have Lyme, what percentage of people go on to develop true autoimmune illness where you know they have an autoimmune illness because you have blood testing that shows that their immune system is actually attacking their own tissues. I have not seen any studies done that look at that. I don't think anyone's looked at those kind of studies, okay? All right, but what can you do about autoimmune illness that happens either triggered by Lyme or that coincides with having Lyme as a separate issue? So one of the things I like doing with my patients that have clear evidence of autoimmune illness is I like to get them on low-dose naltrexone. So naltrexone is a chemical that we use for people with drug overdoses. Now, what does that have to do with autoimmune illness? Well, as in everything in Lyme, it's a crazy world, and we repurpose things that are used in other conditions to help us here. Okay, so here's what happens with naltrexone. So naltrexone is actually manufactured as a 50 milligram pill. And when we use it to regulate autoimmune illnesses and also to help with some of that fibromyalgia type pain that sometimes people get, we use it as something called low-dose naltrexone. So it's manufactured as a 50 milligram pill, but when we use it as low-dose naltrexone, we use it anywhere from about 1.5 milligrams up to 4.5 milligrams a day. Okay. So what happens is our body has its own narcotic system. So this naltrexone is used for people with narcotic overdose, and it's given so that it will block the morphine and cocaine and other type of receptors in the body, narcotic receptors in the body, and kick out the drug that the person is overdosed on. All right. We have our own natural narcotic system, which are called endorphins, a group of chemicals called endorphins. And in our bodies, they regulate pain, but they also regulate the immune system. Okay, that's the linkage. So what happens is we have these endorphin receptors, and if we can block them with naltrexone for a short period of time, which is why we use low dose. If we used high dose naltrexone, you would get permanent blockage, but we want this to be a short blockage. And if you use low-dose naltrexone, those endorphin receptors will be blocked for maybe about 4 to 6 hours, basically. Okay, so the blockade wears off. But while the blockade is going on, while that naltrexone is binding our endorphin receptors, there's two things that happen. Number one, the brain hates it. The brain likes to maintain the balance that the brain likes to maintain. And the brain sends out a bunch of chemical signals to cells in the body that make endorphins, and the brain says, make more endorphins. Okay, so one result of getting a blockade of your endorphin receptors is you get a greater production of endorphins. Number two, those endorphin receptors, when they're blocked, start becoming antsy. They need their hit of endorphins, and they become more sensitive to any endorphins that are still out there. All right. So what happens is at 4 to 6 hours, when that endorphin blockade goes away by the naltrexone or the low-dose naltrexone wearing off, those receptors get flooded with extra endorphins that your brain caused to be made, and they're more sensitive to those endorphins. And that seems to have an effect of regulating an immune system that is over-attacking you, okay? All right, that's one thing it does. From a pain standpoint, there's a receptor up in your brain on a type of cell called a microglia cell, which is kind of an immune cell in the brain, that have these receptors called toll receptors on them. And it just so happens that naltrexone also binds to those toll receptors. And when it binds there, it changes the nervous system signaling of pain that makes your myalgia, fibromyalgia type pain get a lot better as well too. Okay. All right. So you might want to give that a try. I have a whole article about using naltrexone, and I'll show that to you so you can read more about the dosing and how do you start it and how do you ramp up and potential side effects. But that's something that may give you some benefit, okay? There was a period of time when everyone that had Lyme was trying naltrexone because they all thought that it would help their Lyme and immune system function. But keep in mind, and what I saw in my practice is it doesn't help that many people for the Lyme part of things. So if I've got somebody with chronic Lyme that's not getting better, I might try low-dose naltrexone maybe about 9 months or so into treatment, if nothing else that I'm doing is getting them better, on the chances that maybe their Lyme has triggered autoimmune illness that we can't even measure, for instance, okay? I will always, though, use low-dose naltrexone when I have somebody with Lyme that has also a proven autoimmune illness as part of it or in addition to it, like a scleroderma, like rheumatoid arthritis, like lupus. I usually will add in low-dose naltrexone, and I've seen good results with that. Okay. In terms of Lyme that doesn't have a proven autoimmune illness, I see that maybe about 10 to 20% of people may get some benefit using low-dose naltrexone in that situation to regulate the immune system. All right. So let me do a quick screen share here, and I'll show you my low-dose naltrexone article. All right, so let's write in naltrexone up here. Okay, so this is my article. So you can search it up here. You would also find it in the immune system section here on my online Lyme guide. Okay, all right. Thanks for that question, Debbie, and good luck to you. Hello, Paula. Let's see. How would you treat zearalenone mycotoxins? So this is interesting. This is a family of mycotoxins that recently real-time labs that does urine testing is starting to report this one. And Great Plains Lab, which also does it, has been reporting it as well too. At this point, because I haven't seen any specific studies that tell me what's the best binder to use for this one, I have not seen anyone study it, okay? Because of that, what I'm doing is I'm using a combination of clay and activated charcoal. That combination together seems to be able to get most type of toxins out. And so you could use a bentonite clay with another pill that's activated charcoal, or you can find clay and charcoal in a medicine or a supplement manufactured by Biobotanical Research, which is called GI Detox. It has both charcoal and clay in it. You can either do that, or you could use the activated charcoal and bentonite clay as two standalone pills that you use. Okay? All right. Good luck to you, Paul. Hello, Lorraine. Hold on here a minute. I got to get a sip of water. All right. Let's see. Hi, Lorraine. So for Babesia, I'm currently taking Zang Artemisia herb. Each cap is 350 milligram dosage, 3 caps daily for 10 times. I'm on day 7, have 3 more days at this dosage, and currently I'm not experiencing any die-off symptoms other than a slight headache. Prior to this treatment, I was taking a cryptolepis herb for 3 months straight. I still have these Babesia symptoms, temperature fluctuations, dizziness, air hunger, racing of the heart. Because there are no signs of die-off, do you think the dosage is not strong enough? My Babesia is gone, or am I just detoxing very well? So, having a die-off says you are killing, but often, and most often, when you're working with Babesia, people don't get die-off as you're killing it. That's been my experience. Okay, sometimes you do, but most often, usually you don't. When it comes to strength of treatments for Babesia, the herbal options like a crypto and will work. Crypto will work maybe about 75 to 80% of the time. Also, artemesinin will work if you have a type of Babesia. Well, how can I phrase this? We are seeing less and less chance of artemisia and artemesinin working, especially with Babesia from the East Coast. It seems to be learning resistance to that. Okay, and by that East Coast, I mean East Coast of the United States. Okay, I'm still finding artemesinin out here in the West Coast, and from my patients that acquire Babesia in most of Canada, and those that acquire it in the Midwest, I'm still seeing artemesinin work probably about 70% of the time, okay? But in my East Coast patients, I'm generally staying away from it unless I have nothing else I can try with them, because generally out there, we're just not seeing as good of benefits from it, okay? So I'm saying that as a background to say to you that if you're not getting better and on the crypto and the artemesinin, you're not seeing improvements, say within a month or say within 2 months of using it. If something is going to work by 2 months of using it, you should start seeing improvements on Babesia symptoms. If it is not, if your Babesia symptoms are not improving by 2 months of using something, it's time to change to something else, okay? So give your artemesinin a try for a couple months, but if you're not making much headway, then you may want to look at prescription options. Okay, it looks like you're trying to go herbal here, but sometimes you just have to flip over to do the prescriptions. The prescription options tend to work about 85% of the time, okay? All right, let me show you my article about what your prescription options would be, okay? All right. Okay, so this is the Back at Treat Lyme by Marty Ross MD. In terms of how do you get rid of Babesia, take a look at my infection treatment plans section here. And you can read my guide called Kills Babesia, a Brief Guide. And in here, I give you options, including herbal and prescription, that will work. You scroll all the way down here, you'll see them. That will work on Babesia, okay? All right. Lorraine, good luck to you. Thanks for that question. Hi, Lynn. Hold on a minute. I'm gonna have to have a swig of coffee for this next question, I think. Give me enough energy to go through it. Okay, this is our vaccine question for the evening. I knew there would be one here, and here we are. And I will probably use this as a background just to talk about the COVID vaccine and Lyme and what I'm thinking these days, okay? So this could be a bit of a long discussion just because of the information that's out there right now and how to work with it and interpret it. And it's been something I've been trying to look into the data on the Pfizer vaccine, where I have read some of the data that happened with the people in the research that was done on that. And then just also trying to explore the literature and the data about what to do with vaccines and people that have chronic illnesses and autoimmune illnesses if they do, et cetera. Okay, so I'll try to address all that with you here tonight. But here's the question. Hi, Dr. Ross. Is there anything about the 2 cases of anaphylactic shock that occurred right away with the Pfizer COVID vaccine that is instructive about whether this vaccine might pose a risk of a bad reaction for people with Lyme disease? The answer is no, not directly. Now, I'm going to say a lot more than that, okay? All right, so it is true that in, I guess, a couple people that had the COVID vaccine in the United Kingdom did have severe allergic reactions, okay? And it's not clear why they did, and we do not know of anything. Anyhow, I'll just say that, okay? Now, if we look at so first of all, a couple things. The Pfizer study looked at, evidently in doing the research for the Pfizer vaccine, they studied 44,000 people roughly. Okay, so they enrolled 44,000 people in that study. And the adverse outcomes were extremely small. It was an extremely low percentage. The trouble is in their data that they showed, although they do show that this vaccine worked 95% of the time, well, and that data does look very impressive. In terms of how they broke out the data, we do not have any information that they provided about people with autoimmune illnesses or chronic infections. They did not provide data to us in a way that we can tell, did you have one person with Lyme in that study, et cetera. So I have no way of knowing if in their studies and the people that they report as having good outcomes, what about people with Lyme? I don't know. I suspect they probably, we just don't know. That data is not there. So they did not study what happened to people with Lyme when we gave them the COVID vaccine. So we do not have data on that. I want to be very clear. Okay. All right. So then that raises the question of, we've got a vaccine that is very effective, the Pfizer vaccine. I suspect the Moderna is going to be a very effective vaccine as well, too, from what's being reported, although I haven't seen the actual data on that because that's not been published. The only data that has been published, or released at least, was the documents that were provided to the FDA committee that looked at this today, were posted publicly, and I have been through those, okay? But I don't have the actual documents on the Moderna vaccine, okay? Now, both the Moderna and the Pfizer vaccine are a new type of vaccine. The type of vaccine that they are has never been done before. This is a new methodology. And so therefore, I can't look at the way that people with autoimmune illnesses, for instance, or chronic infections have reacted to previous vaccines like the flu vaccine or the hepatitis B vaccine, where we know that there can be sometimes adverse reactions. Those were entirely different vaccines in terms of how they were manufactured and created. Those vaccines, previous vaccines that we have used, are either dead germs or proteins from those germs that are injected into a person. That's generally what vaccines are, okay? This vaccine is different in that what is being done is the vaccine is providing a person genetic code in the terms of something called mRNA that provides information to your own cells about how to temporarily, not permanently, temporarily manufacture a protein found on the covering of the virus called the spike protein, okay? So what happens is your cells get this messenger mRNA genetic code, and they take it in, and then they take it over to their protein production family called ribosomes. And at the level of the ribosome, they manufacture this spike protein found in the COVID germ. And then the cells start releasing these spike proteins, and the immune system sees these foreign proteins and does two things. It develops antibodies against these foreign proteins, and it turns on its T cells, immune fighting cells, white blood cells, to also start attacking these proteins. So that then if you were to get the COVID germ in you, you have antibodies already made to attach to the outside covering of the germ. And in addition, you've got T white blood cells that are programmed to attack that germ too, okay? Now I want to emphasize something. Although this is mRNA and genetic code, it is not permanently embedded into your DNA, okay? Nor is it permanently going to be in you, turning your cells on into protein producing factories. These things are temporary, all right? Now, the issue, so this is a new type of vaccine, so we have nothing to compare it to in terms of what's going to happen to a person with Lyme in this vaccine. And as I said already, we don't have any results from these studies that they broke out what happens to people with Lyme, so we don't know. And then third, I can't report to you any experience yet to know what's going to happen with a person with Lyme, okay? But these are some things that we generally know. What I'm about ready to say are some precautions to take in general, okay? And this is what I'll be telling my patients. Number one, if you are a person that has ever had severe allergic reactions to anything, you probably do not want to get this vaccine, okay? And what I will tell you is that is also a general recommendation that is made for all types of vaccines, okay? So if you have ever had a severe allergic reaction to anything, probably don't get this vaccine, okay? Number one, I said severe allergic reaction. I didn't say like nasal stuffiness or itchy eyes. I'm saying severe allergic reaction, like an anaphylactic reaction, okay? Don't get the vaccine if you've had severe allergic reactions, okay? That's the kind of information we would provide to anyone about anything, okay? Number two, there is some data based upon people that have had adverse reactions to other vaccines, like the flu, like hepatitis B, that the groups of people that tended to be prone to having these adverse reactions were people that had underlying autoimmune illnesses that you could see truly were autoimmune illnesses by blood testing that gave you some indication. So people that might have elevated rheumatoid factors, or people that might have anti-nuclear antibody testing that's positive, okay? And I'm trying to make a distinction here. Not everyone with Lyme has autoimmune illness, okay? There's a prevailing viewpoint out there that they do, but they don't. The majority of people with Lyme don't have autoimmune illness. So what I'm probably going to be looking at is my patients that have evidence, lab evidence of autoimmune illness, like anti-nuclear antibody and like a rheumatoid factor that is positive. On those type of patients, I probably will say, hey, there may be a small chance, very small, because data on previous vaccines tell us it's small, that when you get a vaccine and you already are prone to autoimmune illness because you've got evidence of it in your blood, that you may trigger an autoimmune reaction from getting a vaccine, okay? That's based on previous vaccines that have been used. But I want to emphasize it's actually a relative risk that's small, like a 1.1. It's very, very small if we look at it, okay? So for my patients with autoimmune laboratory evidence of autoimmune illness, I will say, based on my review of other vaccines, that there is an extremely small chance that by getting a vaccine in general, you might trigger autoimmune illness. Now, you have to weigh that extremely small risk of autoimmune illness being triggered by the vaccine against the risk of getting COVID and dying. Okay, all right, that's the kind of comparison you need to do. You need to do a risk-benefit analysis. And so for most people, even with a history of autoimmune illness proven with blood testing, I'm probably going to suggest they get it. But I want them to make the decision because it's up to them to weigh out the risk. Okay, all right, so again, number one, if you've ever had a bad allergy reaction to anything, don't get it. Number two, consider carefully if you have laboratory evidence of an autoimmune illness, do you want to get the COVID vaccine or not? Because there's a small chance that getting a vaccine of any kind might trigger another autoimmune illness to develop, okay? All right. Number three, if you are a person that has gotten a vaccine with Lyme before, any kind of a vaccine with Lyme before, and your Lyme disease got extremely active afterwards, not just a 1 month worsening or a 2 month worsening, but let's say months of worsening, then you might want to reconsider whether you're going to get this vaccine too or not. Okay, all right. Those are my thoughts on it. I think most people with Lyme ought to get the flu vaccine. Or I'm sorry, not the flu vaccine, the COVID vaccine. I think the repercussions of getting COVID are far outweigh any risk that's going to happen to the average person with Lyme, and I think they should get it, with the exception of these three categories that I just said. Number one, if you've ever had a severe allergic reaction, probably don't get it. Number two, if you've had a severe reaction to any other vaccine that lasted for 2 months or more, you probably ought to consider not getting this vaccine, but you have to weigh that out against the risk of harm from COVID. Have that discussion with your doctor, okay? Number three, if you have markers in your blood saying that you have autoimmune illness by laboratory evidence, not just because you think you have Lyme and you think you have autoimmune illness, but because you truly have autoimmune illness, you have to weigh out, you have to have a conversation with your doctor about whether that small risk of triggering an autoimmune illness is something in your situation that you should avoid by not getting the vaccine versus the risk of getting COVID and dying from COVID or having a bad outcome from COVID. Okay? All right. Those are my thoughts. I know it's a complicated topic, but that's kind of what I gleaned from the literature today. Okay? All right. Thanks for that question, Lynn. Good luck to you. Hello, Lorraine. Let's see. Hello, Marty. How important is it to remove biofilm to heal yourself from Lyme and co-infections? How do you know, or what signs can I look for to know when all biofilm and mucoid plaque is gone? Okay. So here's the deal. So everyone, when we have chronic Lyme and even Bartonella, those two germs have been shown to form biofilm. So and what a biofilm is it's a mucopolysaccharide or sugar slime layer that is held together in this complex protein skeleton made up of blood clotting protein called fibrin. The bacteria in biofilm recruit these proteins that are supposed to be part of blood clotting proteins. They pull them into the biofilm and they use them to erect a skeleton that holds this sugar slime layer together, okay? That's a biofilm. It's really interesting. These biofilms can cover Lyme germs, and what they do is they can block out the immune system, and they can also block out the antibiotics from getting in, okay? In theory, that's what they can do, all right? They are even more complex. They have actually more going on than just being sugar slime held together in a protein skeleton. There's actually a bunch of other kinds of bacteria, like all kinds of different bacteria that live in them. And all these bacteria take on different functions. There's tubes in them that bring nutrients in, and there's tubes in them that bring garbage out. I mean, these are complex structures, okay? They have this whole community structure organism. It's like part of them are operating as the post office, part of them are acting as the sewage treatment plant, et cetera. I mean, they really are complex entities, okay? Now, what is interesting is there's no way of knowing they're there. We just assume they are. Okay. In other words, you can't tell if you've done something to remove them that they're gone. There's no way to see them that way. Okay. In research settings, we can see them under the microscope, but it's not something you're going to do as an average Lyme patient. Okay. All right. But here's the good news is you can get rid of them by just killing your germs. We don't really always need to give you something that's going to break down the biofilms. Now, I know that may sound kind of heretical in this environment where Lyme doctors like to give you 20 million different things to take. But if you look at research that was published by Eva Choppy, who's a Lyme disease researcher out at New Haven, Connecticut, she's running a bench science Lyme lab where they do petri dish experiments and test tube experiments. Her work tells us that she published maybe about 8 or 9 years ago. She did a number of studies looking at what happens to which antibiotics do the best at treating Lyme and what happens to biofilms, okay? And what her studies showed us is that antibiotics like tinidazole, a prescription antibiotic, break down about 95% of the biofilm. The antibiotic does, okay? This doesn't mean taking an agent like biocidin or taking lumbrokinase or nattokinase, those things that some people say work on biofilm. This is just killing germs with an antibiotic, breaks down the biofilm, okay? And part of the reason for that is remember I said these biofilms are made up of a lot of germs and everything that have certain functions at maintaining that biofilm. If you take antibiotics and start killing those germs that live in the biofilm, some of the functioning parts of the biofilm fall apart and the biofilm starts to fall apart. All right. Doxycycline, I think, the antibiotic doxycycline, I think breaks down about 60 or 70% of biofilm. Before the discovery of biofilms about 10 years ago or so, I never used to do anything to target biofilms, and people still got better using antibiotics, okay? All right. And that's because I think antibiotics can break down biofilms, all right? Now, when do I actually do something to target biofilms? Well, sometimes if I've got a patient, I'm about 6 to 9 months in treatment, and we're just not making any headway, then I'm going to start wondering, are their biofilms antibiotic resistant? In other words, are their biofilms not falling apart by using the antibiotics, okay? And in that kind of situation, then I'm going to do some targeted biofilm breakers. And the ones that I might look at using the two herbal antibiotics called Atoba and Cat's Claw. Although those two kill Lyme, they actually break up 100% of biofilm. Okay, that's what Eva Choppy's research tells us from 10 years ago. Other ones that I might use lumbrokinase. I might use biocidin. Biocidin can be an extremely good biofilm breaker based on laboratory experiments, okay? But I don't consider really adding any of those things in unless we've already tried regular antibiotics or herbal antibiotics. We're about 6 to 9 months into treatment. We're not getting anywhere. Then I might want to add some things that target biofilm, okay? All right, because you don't always have to, all right? I mean, even before the discovery of biofilms, I never gave anything, most of my Lyme patients, anything that break up biofilm, and they still got better by just doing good old garden variety antibiotics, believe it or not, okay? All right. Thanks for that question, Lori. All right. I'm going to do a quick screen share here, because if you are wondering more about what I just said about biofilms or agents that you can use to break down biofilms and how would I treat biofilms, I have an article about that. Let's see. I'll just write biofilms. Okay, so it's this article called Biofilms, Lyme Disease Gated Communities. And I updated this a little bit over a year, about a year and a half ago now. Anyhow, I talk about what they are, how they function, and what you can do here. Okay, and I believe in this article, I even raised the point that even regular antibiotics will break them apart to a degree. Okay, all right, there you go. Thanks for that question. Hello, Eric. Let's see. Hello. My AST levels are at 56 with a normal range of 10 to 40, and ALT is 120, range of 9 to 46. Should I be worried? Currently taking Mepron. What can I do to help my liver? Thank you. Yeah, I'd like, as I said earlier tonight, I'd like to try to keep my liver enzymes within 2 times the upper end of normal. So that ALT, I would like to keep it at about 92 based on your normal range that you have here. You're at 120, okay? Now, what the issue is with that degree of inflammation is over time, not immediately, but like good months, like months and months of doing it, like 3 or 4 or 5 months of having inflammation or years of having inflammation could eventually lead to scarring of your liver from that inflammation, which then can lead to cirrhosis of the liver, which then means you get into really bad functioning of the liver, okay? All right, so you want to limit the possibilities of that happening. So what I do in a situation like this, I would not stop taking your Mepron, but I would do some things to support your liver to get it so that it can handle the Mepron better and decrease liver inflammation. And what I would do is raise glutathione. So glutathione is the master reparative antioxidant that is manufactured in every one of our cells. The liver uses it to protect itself, but also to detox, okay? And you can supplement it directly. If you're going to do that, I would use a liposomal glutathione. Liposomal means it's microscopically wrapped in fat to increase its absorption. You need to increase its absorption because if it's not liposomal, it's probably getting destroyed in the gut. Okay, liposomal means that it's microscopically wrapped in fat, and it has been shown liposomal products, especially the one called Trifortify by Research Nutritionals, has research done showing that it actually does markedly increase glutathione levels within red blood cells, actually is what they did the research on. But if it's in the red blood cells, it's going to be other cells as well too, okay? And the way I would use that Trifortify product by Research Nutritionals is I would take, with a situation like this, I would do 5 milliliters twice a day. An alternative to doing that, which I don't find to be as helpful, is to actually take N-acetylcysteine, which is one of the building blocks for glutathione that your cells use to manufacture glutathione. And that would be a 500 milligram pill, and you would wind up doing that twice a day. Okay? All right. Good luck to you. Hello, Anne. Let's see. Hi, Dr. Marty. Thank you so much for freely giving your time. Oh, you're welcome. Thank you very much. I enjoy doing this, and I'm glad to be able to help people, which reminds me of one thing. I want to help people, okay? I want to help as many people as possible to get over this stinking illness. So, as many of you know, you're getting help from being here. Can you help me spread the word? I want to reach more people. And to do that, word of mouth does best. So if you're finding benefit, tomorrow, when you get the email with the recording, send it to the people you think might get benefit too. When you get the announcements from me announcing time to sign up for the webinar, send it to people you think might get benefit. Help me to help more people. Okay, I'd appreciate that. Thanks for your comment here, Ann. Hello, Lorraine. Let's see. Talk about leaky gut. I have had it forever, and my huge sign is food allergies. I have since eradicated a year's worth of parasites and would like to try again to heal my gut. Is this possible to do when I still have Lyme? I just don't want to waste more glutamine and other supplements by trying if the Lyme is going to be an obstacle. So leaky gut, everyone. So Lorraine, I'm going to answer your question, but I want to make sure we're all on the same page here. So what leaky gut means is, and I'm going to describe it. So you've got the inside of the intestines with your poop and undigested food and toxins and things you might be allergic to, okay? Right, that's the inside of the intestines. Under that is a layer of cells. So you got poop, a layer of cells, okay? And below this layer of cells is your blood vessels, and 70% of the body's immune system sits right here in the intestinal tract, okay? All right, now, in a healthy functioning intestine that's not leaking, these cells touch up against each other very tight to keep things from here getting into the immune cells down here and the blood vessels, okay? All right, that's what's supposed to happen. Okay, now, the way that things like nutrients that you want to get from the intestines get into the blood vessels is these healthy bacteria that line the intestines do microdigestion of food, breaking corn protein and corn carbohydrates into minuscule fats and sugars and proteins that are no longer recognized as corn, microscopic, okay? They get absorbed into these cells. They pass through the cells, hit all these immune cells, but because they're just pieces of sugar and pieces of protein and pieces of fat that aren't recognized as corn, they don't do anything to these immune cells, and then they get into the blood vessels and they get absorbed and they go to do what we want them to do, okay? All right, now, if you've got yeast or you've got parasite infections, these cells will plump up and pull apart, creating gaps. Now what happens is you get incomplete digested corn and incomplete digested wheat and incomplete digested meat proteins that leak through. And what do they hit? All these immune cells that say, aha, foreigners are trying to get through. We'd better go ahead and block them and react to them. Okay? All right. That's what happens in leaky gut. Okay? So the trick is get the infections under control here so that these can start healing again and closing those gaps, okay? Now, the predominant things that I see that lead to leaky gut are yeast overgrowth and parasite infections, okay? And often, if you correct those, you get rid of those, that's going to be enough for this to start healing. And in addition, taking some additional steps that Lorraine started to mention here, but I'll mention in a minute too, can help that healing, okay? Now, I have seen rarely that Lyme also itself can trigger this leaky gut, because I've gotten yeast out, I've gotten parasites out, and people still keep having leaky gut. But that's rare, okay? So Lorraine, if you've done a good job of cleaning out parasites and you've cleaned out yeast overgrowth that's there, even if you're still treating Lyme with antibiotics, et cetera, and you do things to maintain a healthy gut, you can correct the leaky gut still. That's been my experience most of the time. Not all the time, but most of the time, okay? So get your infections out. So get your yeast and parasites. Lyme, keep working on it, okay? But get yeast and parasites out. Then, if you're still having leaky gut issues, then you want to start healing the tissues and helping get some of the microscopic food digestion to happen too. So I would be on digestive enzymes. I like using a product called Similase. I would do a couple pills before meals 3 times a day. Okay, all right. In addition to that, I would give nutrients to the cells so they can start healing. And what is good to do that is L-glutamine powder that you mentioned. You want to take somewhere around 12 to 16 grams before meals 3 times a day. Okay. And then finally, I would still be on good probiotics. I would also try to use some Saccharomyces boulardii, which is a healthy fungus that lives in the intestines. Do a couple pills once a day of that. I would do human-based probiotics made up of bacteria that live in our intestines. I like using a product called HMF Forte for that, 2 pills 1 time a day. And you might, for about a month or 2, want to provide a barrier protecting those cells so they can heal. And that would be to use a formula called, I'm blanking here all of a sudden. I'm blanking. I'm sorry. Let me show you my article where I talk about what to do with leaky gut, and maybe my brain will work and I can remember that one last thing I wanted to tell you. Let me go ahead and do that here. All right, let's see here. Okay, so I have this article called Leaky Gut Syndrome, a Treatment Guide, okay? And let me see here. Actually, no, I guess what am I thinking? I wasn't thinking correctly there. There is a mucous membrane that you can put on there. But anyhow, I like using the L-glutamine powder, Sacro B that I talked about here, vitamin D, and the digestive enzymes that I was mentioned. And you can read all about that here. All right. All right, Lorraine, thanks for that question. Hello, Suzanne. Hi, Dr. Ross. What about Borrelia relapsing fever? Blood work came back positive for it from red labs. Will this also be treated with antibiotics and the disulfiram? So tick-borne relapsing fever is another type of germ that can be spread by ticks. It is a separate type of Borrelia, different than Lyme disease, okay? Lyme disease Borrelia, all right? However, the things that we do to treat Lyme will also kill it. The only thing I don't know, because no one's done the studies, I don't know that disulfiram has any effect on it, nor do I know if tick-borne relapsing fever forms persisters the way that Borrelia Lyme does and the way that Bartonella can. No one's done those studies. I don't know. All right. But most of the other standard treatments that we would do to treat Lyme Borrelia will also work against the tick-borne relapsing fever too. Okay. All right. Thanks for the question. Hello, Doug. I say hi, Dr. Ross. Are there any developments on new treatments in the work, including any updates on SOT and Azlocillin? All right. So the answer is no. There are no updates on any new treatments coming down the pipeline. Okay. But let me address those 2 things that you just mentioned here. All right. So in terms of new treatments, the biggest groundbreaking thing has been, disulfiram that everyone started using about 1.5 years ago. All right. That has markedly changed the picture of Lyme disease for at least 39% of people that seem to be able to get into remission with it. Okay. All right. The same lab that brought us the idea of disulfiram is a lab in California out of Stanford University, Dr. Rahadis's lab. And the way that they discovered disulfiram is they basically took every available drug in the prescribing database in the United States that has been approved by the FDA, and they tested them against Lyme persisters that they grew in the lab, and they saw if they would kill them. All right. And they discovered, kind of as a footnote in their research, because it really was, there wasn't much of a mention in their published article at all, that disulfiram, it was kind of like, oh, by the way, we discovered that disulfiram, this drug that we use to treat alcoholism, has some benefit. It was kind of like an afterthought paragraph in there, okay? But that little afterthought paragraph actually took the world by storm. That same lab has Dr. Rahadis's lab has shown that azlocillin in both, I believe, Petri dish experiments and I believe now in mouse experiments is an antibiotic that can treat both growing Lyme as well as persister Lyme. The disulfiram, their studies only looked at persisters, so we don't know whether disulfiram actually truly treats growing Lyme or not, but their azlocillin studies suggest it can treat growing Lyme as well, I believe. Okay, now, here's the problem with azlocillin. We still have no human studies, and the drug's not available. All right. So even though it's an approved drug in the FDA database here in the United States, there's no manufacturers of it right now. And so Dr. Rahadas, at the last I understood, he was trying to put together a company to start manufacturing it, but I don't know where that is. You have the same access to the same news sources I do on that. I don't know where that is. Okay, now I'm going to give you a word of caution about it though. Yes, the laboratory evidence looks great, fantastic. Okay. The trouble is what happens in a lab and what happens in a mouse does not necessarily mean it's going to happen in a human. Okay. So by example, the other major lab in the country that's doing a lot of research looking at persisters right now is Ging Zhang's lab out of Johns Hopkins University. And about, I think 2 or 3 years ago now, they showed in laboratory experiments that using an antibiotic called cefotaxime, coupled with doxycycline, coupled with, I believe, Bactrim, daptomycin, I'm sorry. So daptomycin, doxycycline, and cefotaxime were going to be in the lab looked really promising in terms of killing persister Lyme. They also did mouse experiments, and these mouse experiments looked fantastic. This looked like this was going to be the cure for everyone. Well, they never did a human study on it, but when many of my colleagues started using it in their practice, they found it to be terribly disappointing. Okay, so I just want to caution. I know everyone's thrilled about this azlocillin. I don't know if it's going to work, and we won't know if it's going to work until somebody starts manufacturing it. Okay, SOT. SOT stands for supportive oligonucleotide therapy. I have a whole article on it in my website. What I will tell you is I am extremely skeptical. And here's why I'm extremely skeptical. So what this does is it uses genetic code to program, to block the replica, to get it so that the Lyme germ that is trying to grow cannot make the proteins. It blocks protein. I'm not even making sense here. It uses genetic code to block the production of proteins at the level of the protein production factory in cell called ribosomes. It uses this genetic code, to block the production of proteins of the Lyme germ. And supposedly the Lyme can't replicate that. Okay, that's in theory. Okay, now I'm going to use the current COVID. So first of all, no one's done any studies to show this stuff works. Okay. And the problem with giving these genetic code, these oligonucleotides, is they have to get into the cell. Okay, they got to get there. Okay, and they're unstable. All right. In fact, they're so unstable that when a similar approach was used for the current COVID vaccine, do you want to know how unstable they are? Okay, so by comparison, the COVID vaccine, the Pfizer vaccine that just got approved, is using a type of oligonucleotides called mRNA, but they are genetic code too, the same way that SOT is genetic code, but SOT is a laboratory put together genetic code. Okay. All right. Now, they're both genetic code though. Okay. Genetic code is unstable because our blood is full of enzymes that can destroy it. Okay. All right. The way that they did the Pfizer vaccine to deal with this, to stabilize it, is they're microscopically wrapping it in fat. Okay. But it's so unstable, they have to have it travel to the source at minus 90 degrees, okay? And it can only be out of the refrigerator or out of the freezer for a short period of time. That's how unstable it is, okay? I have a hard time believing that this SOT that people are using is even getting to the person in a form that's still working, It's unstable stuff. And I do admit that some people that get the SOT get benefit, but there's something that's called the placebo effect. All right, if you look at any drug in the prescribing database, about 30% of all drugs in the prescribing database have been shown in laboratory experiments to work by getting people better as a placebo effect. That's regular prescription drugs. What makes us think that SOT, that people getting it, just the act of getting it somehow triggers a placebo effect that makes them feel better? So anyhow, I'm skeptical. I'm skeptical that this stuff is stable. There's been no research done that the manufacturers this have ever done showing that it actually gets into the cells. There's no research that the manufacturers have done that ever shows it works. And we've got a few clinics around the country that somehow have gotten their hands on it from the Greek manufacturer that are claiming great benefit, and they're making a lot of money doing it. But there's no research that says that's even plausible. And I can tell you from just looking at how unstable the current mRNA genetic code vaccines are, and that I can't believe that the SOT is even getting into people in a form that's stable and capable of working. Okay, so those are my thoughts. All right. Thanks, Doug. Hello, Cost. Let's see. Why would a Lyme have a high selenium without taking supplementation? Oh, I think what you mean is why would a Lyme patient have high selenium without taking supplementation, or do you mean a Lyme germ? The answer is either one. I don't know. I'm sorry, I don't have an answer for you on that one. Hello, Paige. Let's see, Dr. Ross. Thanks for existing. You're welcome. I don't just exist. I'm thriving. Anyhow, I get your point. Thank you. Let's see. Okay. Son has been diagnosed very late, Lyme, Babesia, and Bartonella, got tested at Galaxy, and are doing our 7th protocol of rifabutin and clarithromycin. He is 17, got sick when he was 11. He is losing hair. Can you help? So the answer is I might be able to, okay? So a few things to think about. If he's done a number of rounds, oh, you're doing your 7th protocol. Oh, so if you're doing the same thing again and you keep getting no improvement, it may be that he needs to change to a different antibiotic protocol, okay? So number one, there's a number of different antibiotics that we can use. So rifabutin, clarithromycin are agents that can treat growing Bartonella. We now also know, based on research that was published out of Ying Zhang's Johns Hopkins lab over the last year, that Bartonella can form persister cells, which is non-growing forms. Germ goes into hibernation, lives in biofilm, and just slows its hibernation, slows its metabolism way down, hibernating, and can ignore the antibiotics, the regular antibiotics, okay? So two things that I would consider doing with your son if I were to help him. Number one, I would look at using a couple different antibiotics. If these haven't worked, I might consider, for instance, doing an azithromycin with a minocycline or a doxycycline as my 2 antibiotics to treat growing Bartonella. I also would consider adding some oregano oil and something called methylene blue into his treatment to treat persister forms of Bartonella and to break down Bartonella biofilms as well too. Okay, all right. The other thing I would do if he's not getting any better, I would want to make sure that his Lyme or Babesia has been treated. If not, it needs to be corrected. If somebody's not getting better, I'm going to start looking to make sure they don't have mold toxins build up in them. I'm going to start looking at other things that may be keeping them ill as well too. Okay, all right. I'm going to show you 2 things to take a look at to help give you more information here. Okay. So first of all, in terms of how do you treat Bartonella, what are the different antibiotics you can use for growing Bartonella and what can you do for persister Bartonella. Take a look at my infection treatment plan section here. Take a look at my article called Kills Bartonella, where I talk about combinations of antibiotics you can use to treat growing, as well as what you can use to treat persister forms, okay? And I give you combinations that you can use up here, sample combinations right there that deal with both of those, okay? All right. All right. The other thing that you may want to take a look at is, well, actually, I'll just do it here. You can take, if you want, I could do online visits with you and your son. And to find out more about how I do that, take a look, click at this clinic link up here. That's going to bring you over to my practice website. Look at my appointments page and go down here and look at my two options, my full medical service as well as my limited consult service. Read through both of these to figure out which one's right for you. It includes cost, length of visit, what to expect. Read all of this information, okay? All right. And then if you decide you want to do one of these visits, you can literally book the appointment by just clicking on this book now button here, okay? All right. All right. Good luck to your son, Paige, and thank you for your comment initially. Hello, Margaret. Let's see. In neurological Lyme, have you ever seen Lyme mimic Parkinson's rather than triggering it? How do you tell the difference? It's a good question. So Lyme can sometimes be the cause of multiple sclerosis and sometimes be the cause of Parkinson's disease, okay? All right. In addition, Lyme can sometimes cause some disturbances in can create what I would call Parkinson's-like syndrome, where somebody doesn't technically meet all the standards that we would say that somebody with Parkinson's should have, but yet they have a lot of the symptoms suggesting Parkinson's. I call that Parkinson's-like syndrome. Lyme can cause that too. Okay. Now, the issue when somebody has Parkinson's is that although Lyme can cause Parkinson's, it is also possible that a person can have Parkinson's and they have Lyme as two standalone illnesses, and the Lyme has nothing to do with their Parkinson's. How do we tell the difference? There's no way. There's no way that we can do it. Yeah, when I get into a situation like this, I usually will treat for the Lyme, and I will also have a person get on Parkinson's treatments. Sometimes you have to do both. Even if it is Lyme causing Parkinson's, unfortunately, what I have found is only about 25% of people get benefit by treating the Lyme anyhow, okay? It's a harder condition to treat, unfortunately. All right? All right. Good luck to you, Margaret. Thank you. Hi, Bethany. Let's see. Is frothy semen and urine normal during recovery of Lyme? I've had an analysis done without any further positive results. To be honest, I don't know. I haven't seen any studies about that, nor have had the experience about that. Okay? All right. Thanks for that question. Hello, Kathy. Let's see. I'm newly diagnosed with Lyme, but have had it for 7 to 8 years. Doctors kept telling me I couldn't have it because it would show up in my blood tests. Is it too late for me to get help? No, it's not too late. It's never too late. I had a person, for instance, that saw me earlier this year. About a year ago, she started seeing me and came in with a 25-year history of Lyme that had never been treated, never, all right? And she wanted me to try that new disulfiram, which generally I usually don't want to use on people that haven't ever been treated before, because the only lab evidence that we have with disulfiram is that it helps persisters. We don't have any evidence that it treats growing garden variety Lyme, okay? But in her situation, I decided she wanted it. And I told her, I said, I can't guarantee it's going to work. But within, we're now a year down the road, about 10 months down the road, and she is 100% normal. Okay. All right. All right. Now, that doesn't mean if you choose disulfiram that it's going to work for you, but it worked for her. I have other stories of people that came to see me with 20 plus years of Lyme that hadn't been treated before, that using standard antibiotics like doxycycline coupled with metronidazole, that they got 100% well too. All right. Now, having said that, I want to let you know, sometimes when you've had Lyme for years, it's going to take longer to recover from it. And in fact, when somebody has chronic Lyme of a year duration or more, we're talking on average 1 to 2 years to get well. Okay. And when we treat people, even with ongoing antibiotics, there still is a chance, in my experience, that about 20% of people, 15 to 20% of people, we're not able to help. But that still gives you a great chance, 80 to 85% chance that with prolonged treatment, you can get well or a lot better. Okay. So no, it's not hopeless for you. I think it's a good time to start getting treated. Okay. All right. Good luck to you, Kathy. Hello, Geraldine. Let's see. What do you think of Lyme testing by medical diagnostics labs or MDL? I think there's better testing. I think when their testing comes back positive, it is correct. Okay. But if their testing is negative, I think there are better labs out there. For a Lyme test, my favorite lab to use and the favorite test to use these days is the Immunoblot by IGenex Lab Immunoblot. It tests to see if you have antibodies against 8 kinds of Lyme germs. And in addition, they use genetically modified proteins to do the test from these 8 kinds of Lyme germs that remove the possibility of false positive test. Okay. That test, based upon their internal validation studies, will find Lyme 95% of the time when it's there. I think it is the best test out there right now. Okay. All right. Thanks, Geraldine. Good luck to you. Hello, Johnny Z. Let's see. Hi, Dr. Ross. I'm leaning toward the IGenex Bartonella Western blot versus the Lyme Immunoblot, as I can only afford one test right now. My symptoms are pressure in head, dizziness, eye loss and sensitivity, dry sinuses, soles of feet, and fatigue. Any thoughts? And do I need to order both the IgG and IgM for either test? Thank you. So, Johnny, just based on what you just wrote here, yeah, I would probably err more towards the Bartonella, but I would really be helpful to give you the best advice would be to ask you tons of questions. But I obviously, and I know that would cost money too, and I know funds are tight, but based just on what you wrote here, I would do the Bartonella Western blot, and there is something to be learned from getting both IgM and IgG. Okay, so I would do both of those. Okay, all right. Thanks for that question. Hello, Patsy. Let's say, Dr. Ross. Thank you for everything you do for the Lyme community. What's your opinion on using CBD oil for someone who has Lyme and Bartonella and is taking disulfiram, methylene blue, antibiotics? Will the CBD oil help with pain, inflammation, and Herx reactions? I have no opposition to you trying CBD oil in these kind of situations and what you're on. And yes, it could help. Okay. And for more information about what it can do and how it might work, we're actually I'm short on time right now. It's already near the end of the webinar. I'm going to show you my CBD article. Okay. It has more information in there, but to answer your question, yeah, you could use it with all this and it may give you good benefit too. Doesn't mean it will, but it may give you good benefit, and it is okay to take it with all of these things too. Okay. Let me do a quick screen share here. All right. Okay, so I have an article on medical marijuana. It's called Medical Marijuana, Cannabis, and CBD for Lyme. Okay. And this is one where I reviewed the limited research that out there. And it's very limited research, but put together my thoughts on doing it and how it might work and what kind of things can it help. Okay. All right. So there you go. All right. All right, everyone. That's it for me for tonight. It's been good to be here with you. I've enjoyed it very much. And I look forward to working with all of you again. I hope you join me next week. Tomorrow morning, you will get an email from me, hopefully before 9:30 a.m. Pacific Standard Time, Seattle time. And take a look at that. It will include information about the recording, as well as have links to sign up for the next webinar. And share it. Share it with everyone, okay? I want to spread the word. Help me do that, all right? Good night, everyone. Look forward to seeing you next week.